U.S. monkeypox cases are very rare. Monkeypox does not occur naturally in the United States, but cases have happened that were associated with international travel or importing animals from areas where the disease is more common. Scientists at the Centers for Disease Control and Prevention, CDC, are collaborating with the Massachusetts Department of Public Health to investigate a situation in which a U.S. resident tested positive for monkeypox on May 18 after returning to the U.S. from Canada. CDC is also tracking multiple clusters of monkeypox that have been reported in early to mid-May in several countries that don't normally report monkeypox, including in Europe and North America. It's not clear how people in those clusters were exposed to monkeypox, but cases include people who self-identify as men who have sex with men. CDC is urging healthcare providers in the U.S. to be alert for patients who have rash illnesses consistent with monkeypox. Monkeypox was first discovered in 1958 when 2 outbreaks of a pox-like disease occurred in colonies of monkeys kept for research, hence the name monkeypox. The first human case of monkeypox was recorded in 1970 in the Democratic Republic of Congo during a period of intensified effort to eliminate smallpox. Since then, monkeypox has been reported in humans in other Central and Western African countries. Monkeypox is a rare disease that is caused by infection with monkeypox virus. Monkeypox virus belongs to the orthopoxvirus genus in the family Poxiridae. The orthopoxvirus genus also includes variola virus, which causes smallpox, vaccinia virus, used in the smallpox vaccine, and cowpox virus. Monkeypox cases in people have occurred outside of Africa linked to international travel or imported animals, including cases in the United States, as well as Israel, Singapore, and the United Kingdom. The natural reservoir of monkeypox remains unknown. However, African rodents and non-human primates, like monkeys, may harbor the virus and infect people. Treatment. Currently, there is no proven, safe treatment for monkeypox virus infection. For purposes of controlling a monkeypox outbreak in the United States, smallpox vaccine, antivirals, and vaccinia immune globulin, VIG, can be used. Learn more about smallpox vaccine, antivirals, and VIG treatments. Link in description. Information for clinicians. The first symptoms of monkeypox include fever, malaise, headache, and sometimes sore throat and cough. A distinguishing feature of monkeypox from smallpox is lymphadenopathy, swollen lymph nodes. This typically occurs with fever onset, 1 to 2 days before rash onset. Prevention. There are a number of measures that can be taken to prevent infection with monkeypox virus. Avoid contact with animals that could harbor the virus, including animals that are sick or that have been found dead in areas where monkeypox occurs. Avoid contact with any materials, such as bedding, that has been in contact with a sick animal. Isolate infected patients from others who could be at risk for infection. Practice good hand hygiene after contact with infected animals or humans. For example, washing your hands with soap and water or using an alcohol-based hand sanitizer. Use personal protective equipment, PPE, when caring for patients. Gineostem, also known as Imvamune or Imvanex, is an attenuated live virus vaccine which has been approved by the U.S. Food and Drug Administration for the prevention of monkeypox. How was the outbreak contained? CDC and the public health departments in the affected states, together with the U.S. Department of Agriculture, the Food and Drug Administration, and other agencies, participated in a variety of activities that prevented further spread of monkeypox. This included extensive laboratory testing, deployment of smallpox vaccine and treatments, development of guidance for patients, healthcare providers, veterinarians, and other animal handlers, tracking potentially infected animals, and investigation into possible human cases. Partners in the response issued an immediate embargo and prohibition on the importation, interstate transportation, sale, and release into the environment of certain species of rodents including prairie dogs. FDA later rescinded the part of the order that restricted the capture, sale, and interstate movement of prairie dogs or domestically bred African rodents, but CDC's restriction on the importation of African rodents remains in place. What caused the 2003 U.S. outbreak? Investigators determined that a shipment of animals from Ghana, imported to Texas in April 2003, introduced monkeypox virus into the United States. The shipment contained approximately 800 small mammals representing 9 different species, including 6 types of rodents. These rodents included rope squirrels, tree squirrels, African giant pouched rats, brush-tailed porcupines, dormice, and striped mice. CDC laboratory testing showed that 2 African giant pouched rats, 9 dormice, and 3 rope squirrels were infected with monkeypox virus. After importation into the United States, some of the infected animals were housed near prairie dogs at the facilities of an Illinois animal vendor. These prairie dogs were sold as pets before they developed signs of infection. All people infected with monkeypox became ill after having contact with infected pet prairie dogs. A study conducted after the outbreak suggested that certain activities associated with animals were more likely to lead to monkeypox infection. These activities included touching a sick animal or receiving a bite or scratch that broke the skin. Another important factor was cleaning the cage or touching the bedding of a sick animal. No instances of monkeypox infection were attributed exclusively to person-to-person contact. Information for veterinarians. Veterinarians should consider all mammals susceptible to monkeypox and be aware of how the disease transmits from animal to animal. Veterinarians who decide to treat animals with suspected monkeypox should use infection control precautions to protect themselves, staff, clients, as well as other animal patients in the clinic. For more information, there is a link: Forum Centers for Disease Control and Prevention. Thank you for watching.